safety as a definition is simply to prevent harm, but to me, safety is so much more than that. I think of safety as more of an umbrella term and one that encompasses many important aspects of nursing: advocacy, collaboration, communication with our peers, administration, and most importantly, our patients. It's accountability, it's standardization of well-researched and well-thought-out processes. Here in the cath lab, we live by well-researched processes, from closure device protocols to specific cardiac care pathways, and it's because of this that we have one of the lowest complication rates in the nation despite being the busiest. Safety also takes me back to the IOM report from 1999, To Err is Human. This report really took a magnifying glass to the healthcare system and highlighted what we must do in order to prevent error and improve healthcare as a whole. So you see, safety is not simply what we do, it's who we are as a healthcare team. And safety really allows us to rise to the occasion. And I live for that.
Creativity means a lot to me by just doing a lot of things that's fun. And I enjoy working with everyone that I work with for these last 17 years that I've been here. I collected funds for camping hunger, and I make a goal of how much I'm going to collect, and I always go over my goal. I make it fun. Like last year, we made turkeys, and I write everyone's name on the turkey, and I made a design on the board. So everybody was fond of that. And this year, I put myself into 1,000, and I went beyond that. And I created by asking everyone, being friendly, being kind. I always tell people a job is not what it is, it's what you make of it. Because people want to, oh, I'm tired of this, I want to go to another unit, but you think it's going to be any better? It's you that have to make the job and make it creative so you could enjoy what you do.
Teamwork, working with materials management, means that we would have to work with doctors, PCAs, BAs, nurses, the nurse managers as well. And without that, we wouldn't have the proper materials or supplies to maintain the unit or the patient. So that's a big thing for us to work as a team. What I do in KCC6 is I order all supplies that are needed in the unit to help with patient care. I help nurses as well find product. I also organize the unit to make everything easier for doctors, fellows, the nurses. And whenever the product is needed from a nurse, I'll get it for them, bring it to them in the room. Any specialty product that I really don't carry from the unit, I typically rely on my teammates that carry in other units to help me out with that. And I have to give thanks to them as well, because working together, we get a lot of better results.
Empathy means to me to be compassionate, to place yourself in those person's shoes, to take a moment out of your busy schedule and simply be there for that person in their vulnerable state of mind or being. You have doctors that come in to treat their medical diagnosis. You have nurses that come in to aid them and give them medication. But when you have someone as simple as myself and bring in the nutrition, and you take out that extra 2 minutes or a minute and just let them know that you are available for them, and make that eye contact and letting them know that I'm here for you, not only to bring your food, but also to hear you. And just, even if it's through a smile, it goes a long way.
Agility means to me being able to rapidly adjust patients' treatment plan and act accordingly. As a nurse practitioner covering cardiology units, I oversee the care of patients with various medical comorbidities. In addition to their presenting cardiac diagnosis, it's a population whose status can rapidly change from stable to unstable. As a frontline provider, being innovative and a critical thinker must be coupled with agility in order to quickly adjust and develop the now unstable patient's plan of care. As the patient status rapidly changes, we must be able to just as rapidly transition to maintain high quality treatment the patient will need at any given moment and enable optimal recovery. This will allow the patient to subsequently transition from hospitalization to safe discharge. I must say that I take pride in being a part of winning in a national recognized group of medical professionals that thrive in these unprecedented times.